Hi everyone, my name is Ling, and in this talk, I'm going to share with you all our study on designing online peer support for parents, reducing adolescent mental health risks. This work is a collaborative effort between Action Lab at Faculty of IT and YAP Lab from the Turner Institute for Brain and Mental Health. Both of our teams are from Monash University in Melbourne, Australia. Let's now look at the overview and the key takeaways of our study. So in this talk, we're going to talk about the background and the design motivation that motivated this study. And then we're going to move into talking about the study design and the methodology before we share with you the findings, key themes identified from both our qualitative studies, that is the interview study and the workshops, and finally, we will share our design implications. A little bit about the background and design motivations. So adolescence is a very important and impactful period of development. And come with the development is the mental health challenges and problems. So adolescence is a very vulnerable period for young people to develop mental health issues. At the same time, while parents can act as a protective factor, but the literature show that there's a low engagement of parents in self-directed intervention, which can limit the effectiveness of this intervention because of the low engagement. Parents also express their need for a peer support community to learn and implement parenting strategies that they have learned from, for example, online interventions. So the existing literature and the background helped us arriving at a place where we've identified our main design motivations, that is, the current interventions, while being evidence and research based, that is, their strategies do work, often are not engaging enough. Parents can't reap the benefit out of it fully. Whereas peer support communities, they are valuable, but they can't guarantee that the experience or strategies shared in the community would work for other parents and other families in a more general sense. Our aim was to create a digital solution or digital tool that combines the best of these two worlds. So peer support community with a evidence-based parenting program. In our study, we make two key contributions to the CHI community. First, we document the very specific challenges and concerns related to engaging parents in an online peer support community, which is crucial. So these challenges are very crucial for designing effective and accessible support mechanisms. Based on this, we then discuss how a two-phased, person-centered design process synthesized with multidisciplinary evidence can help a research team like ours to purposefully design and co-design an online peer support community. We then introduce this innovative approach that we have proposed that integrates a peer support community with an evidence-based online intervention for parents. And by doing this, we aim at enhancing the overall engagement and provision of support for our targeted help-seeking population, in our case, the parents. Motivated by the considerations, we conducted a two-phased qualitative study comprising in-depth parent interviews and participatory design workshops. So in our interviews, we engaged 19 parents who share their experience in navigating the parenting challenges related to raising a teenager who may have mental health challenges and concerns. Our parent design workshops with 5 parents focused on how an online parenting community can be designed to act as an adjunct component to existing evidence-based intervention, and by combining these two mechanisms, how to optimize the support that parents will receive and access. So we've collected the data, and then with our multidisciplinary team that we have expertise in HCI design and psychology, we've developed the key themes. And then iteratively, we triangulated the themes from interviews and the workshops, and then we relate and linked and integrated these themes with relevant theoretical and empirical evidence from these different disciplines as well, that is not limited to HCI, but also or design, but also thinking about psychological evidence for what the fundamental needs that we need to support and meet. In our findings from our interviews, they revealed a common theme, that is, parents do want to learn from other parents in the form of lived experience. They want to hear other parents' experience. That is, they value and they also expect to learn from other parents sharing about their experience. They also feel that this sharing can act as a factor to normalize their feelings of distress, of doubt, and concerns related to parenting a child who is developing and changing regularly and might be at risk of mental health issues. But at the same time, they're also held back by a couple of concerns. The first one is that the fear of judgment or judgmental attitudes. So parents share their views that they tend to think judgment, that is, judgment passed on from one parent to another, is quite common in everyday life, but it's worse in online communities. Parents also share an attitude where they feel reluctant to share their own personal experiences. That is, in the community, they are expecting to see others' experience, but they don't want to share their own experience. Our workshop findings further articulated how, from the parents' perspectives, an online community integrated with a parenting program can enable them to practice or implement parenting strategies. So they shared a common need to feel connected with others. That is, oftentimes they feel isolated in their own parenting journey. So they said that they wanted to see how others are doing. For example, they told us that when you've learned a parenting strategy from this parenting program, you want to see how other parents are doing it, or does it work for them because it didn't work for me? Scenarios like this, and they also feel that this connection will make them feel less lonely in their parenting journey because of a question that they often ask themselves. That is, am I the only one who has this problem? Do others also experience this? Parents also highlighted that they have a recognition that it's important for them to facilitate their children's growth, and they can better understand and support their children if they have a good parent-child relationship. So when the relationship is not ideal, according to the parents, it's harder for them to connect with and understand their children, therefore reduces their ability to better support them. Our final key findings from the workshops is that parents want support from a community that built their confidence. They shared their worries about having self-doubt, and this self-doubt is made worse when their child is at risk of mental health issues. And this self-doubt also creates distress for them at a personal level. The two reasons led them feel that they wanted support mechanisms that enable them to grow confidence together. So after we've identified the key findings, we then ground our findings from the interviews and design workshops in the existing literature to clarify the key design issues, which then leads us to integrate the relevant theoretical and empirical evidence from HCI, psychology, design, and related fields to formulate the main design implications listed here. So the three design implications here, they point to the key constructs that the digital solution or tool should focus on in order to address the barriers shown in our findings earlier. For example, cultivating empathy within the community to create a safe, non-judgmental space, or building confidence and self-efficacy in parents by contextualizing the evidence-based strategies with real-life parenting experiences. And the final one being supporting parenting, understanding adolescent development, and fostering a positive and supportive parent-child relationship. So in our paper, we've articulated in much more detail how the digital solution can mediate the key construct, that is empathy, confidence, self-efficacy, and growth in parent-child relationships through purposefully designing the facilitation mechanism and the content creation process in the peer support community that enable the multi-level support intended by the design of our digital tool. For more details and related information, please check out our paper at this QR code. If you want to reach out, please use this email right here, and we very much look forward to hearing from you. Thank you very much, everyone.